If you are thinking about starting Ozempic, Wegovy, or Mounjaro, stop. Not forever, just for the next few minutes. Because before you inject anything into your body, there are 5 medical tests your doctor needs to run first. And I'm not talking about a basic checkup. I'm talking about specific, targeted blood work and screenings that can literally determine whether these medications will help you or seriously hurt you. I've talked to women across the country who started these injections without getting properly tested, and some of them paid a very real price for it. So today, we are going through every single test, why it matters, and what you need to ask your doctor before you ever fill that prescription. Hey, welcome back. I'm so glad you're here, especially today, because this topic is one that I feel really strongly about. Weight loss injections like Ozempic, Wegovy, and Mounjaro, which all belong to a class of medications called GLP-1 receptor agonists, are everywhere right now. You've seen them on social media. You've heard celebrities talk about them. Maybe your friend just started one. And yes, the results can be significant. The clinical trials are real. The FDA approvals are real. But what isn't talked about nearly enough is what needs to happen before you start. These are powerful medications. They change how your body processes food, regulates blood sugar, slows digestion, and signals your brain around hunger. And that kind of impact on your body requires preparation. It requires baseline data. It requires your doctor knowing exactly where your health stands before introducing something this significant into your system. So let's get into it. 5 medical tests, why you need each one, and what the results might mean for you. The first test is a thyroid panel, and this one is non-negotiable, especially for women. Here's why. Your thyroid is a small butterfly-shaped gland in your neck, but it controls an enormous amount of what happens in your body. Your metabolism, your energy levels, your weight, your mood, your hormones. When the thyroid isn't functioning properly, it can cause unexplained weight gain, fatigue, hair loss, brain fog, and a whole list of symptoms that look a lot like other conditions. Now here's where it gets really important in the context of weight loss injections. The FDA has issued a black box warning. That's the most serious warning the FDA gives on GLP-1 medications like Ozempic, Wegovy, and Mounjaro regarding thyroid tumors. Specifically, in animal studies, these medications were associated with thyroid C-cell tumors, including a type of thyroid cancer called medullary thyroid carcinoma, or MTC. Now, it has not been conclusively proven that this happens in humans, but the warning exists for a reason. And because of that, anyone with a personal or family history of medullary thyroid carcinoma or a condition called multiple endocrine neoplasia syndrome type 2, which is a genetic disorder that increases the risk of certain tumors, should not be on these medications at all. A thyroid panel will check your TSH, your T3, and your T4 levels. It gives your doctor a complete picture of how your thyroid is functioning right now. And if there are any red flags in your personal or family history, that needs to be part of the conversation before anything else. Do not skip this test. Do not let a doctor skip it for you. The second test is a comprehensive metabolic panel, and this one tells your doctor a tremendous amount about your body's internal environment. A CMP checks your blood glucose levels, your kidney function, your liver function, and your electrolyte balance, all in one blood draw. And every single one of those categories is directly relevant to starting a GLP-1 medication. Let's start with blood glucose. These medications were originally developed to treat type 2 diabetes. They work partly by stimulating the release of insulin and reducing glucagon, which together help lower blood sugar. If you're not diabetic, but you're using one of these medications for weight loss, your doctor still needs to know exactly where your blood sugar is starting from. Hypoglycemia, low blood sugar, can be a side effect. And if you're already on the lower end, that's something that needs to be monitored carefully. Now let's talk about the liver. Ozempic and its counterparts are metabolized through the body in ways that can interact with liver function. If you have elevated liver enzymes or an underlying condition like non-alcoholic fatty liver disease, which, by the way, is extremely common and often completely silent, Your doctor needs to know this before prescribing. Some women have elevated liver enzymes and have absolutely no idea because there are no obvious symptoms. And kidney function. These medications can affect how the kidneys process fluid and electrolytes. For women with pre-existing kidney issues, even mild ones, this is a critical baseline to establish. A comprehensive metabolic panel is a simple blood test. It's usually covered by insurance when ordered as part of a pre-prescription workup. Ask for it. Insist on it. Test number 3, and this is one that most women have never even heard of: lipase and amylase levels. These are pancreatic enzymes. Here's the connection. One of the most serious potential side effects of GLP-1 medications is pancreatitis, which is inflammation of the pancreas. This can range from uncomfortable to genuinely dangerous. And in rare but documented cases, people have developed acute pancreatitis after starting these medications. Lipase and amylase are enzymes that your pancreas produces to help digest food. When those levels are elevated in your blood work, it can be a sign that the pancreas is already under stress, even if you have no obvious symptoms. If you start a GLP-1 medication on top of a pancreas that is already struggling, you are significantly increasing your risk. Now, this doesn't mean that everyone who has slightly elevated pancreatic enzymes cannot take these medications. But it means your doctor needs to evaluate this carefully, potentially refer you to a gastroenterologist, and make an informed decision, not just hand you a prescription because you asked for one. Symptoms of pancreatitis can include severe abdominal pain that radiates to the back, nausea, and vomiting, and these can come on suddenly after starting a new medication. If you develop any of these symptoms after starting an injection, you need to go to the emergency room. But the goal here is to know your baseline before you ever get to that point. Ask your doctor specifically to check lipase and amylase. This is not always part of a standard panel, so you may need to request it by name. Test number 4 is your HbA1c combined with a fasting insulin test. And together, these two numbers paint a really important picture of where you are on the metabolic spectrum. HbA1c, hemoglobin A1c, is a measurement of your average blood sugar over the past 2 to 3 months. It's the gold standard for diagnosing and monitoring diabetes and prediabetes. A normal HbA1c is below 5.7%. Prediabetes is 5.7% to 6.4%. A diagnosis of type 2 diabetes starts at 6.5% and above. Now, many women who are seeking weight loss injections are somewhere in that pre-diabetic range, and they may not even know it. Understanding your HbA1c helps your doctor determine the appropriate dosage, set realistic expectations, and understand how aggressively to monitor your blood sugar while you're on the medication. Fasting insulin is a slightly different measure. It tells you how much insulin your body is producing right now in a fasted state. High fasting insulin, even with normal blood sugar, can be a sign of insulin resistance, which is a condition where your cells are not responding to insulin properly. Insulin resistance is associated with conditions like polycystic ovarian syndrome, PCOS, which affects a huge number of women and is often underdiagnosed. Here's why this matters specifically for GLP-1 medications. These drugs work in part by stimulating insulin release. If your body is already producing excessive insulin due to insulin resistance, your doctor needs to understand that dynamic completely before prescribing. It also helps explain why some women see dramatically different results from these medications than others. Metabolic health is not one size fits all. Getting both of these tests together gives you and your doctor the clearest possible picture of your metabolic starting point. And the 5th test, this one surprises people, is a gallbladder ultrasound, or at minimum, a thorough gallstone risk assessment. This is so important, and it is almost never discussed. GLP-1 medications slow gastric motility, meaning they slow down the movement of food and bile through your digestive system. One of the side effects of this is that it can contribute to the formation of gallstones. And rapid weight loss in general, which is what these medications can cause, is already a known risk factor for gallstones. Combine the two, and the risk increases significantly. Gallstones can range from completely asymptomatic to causing severe pain, infection, and in serious cases, requiring emergency surgery. Women are already at higher risk for gallstones than men, especially women over 40, women who have been pregnant, women with higher body weight, and women with a family history of gallbladder issues. Before starting a GLP-1 medication, your doctor should ask you specifically about your history. Have you ever had gallstones, gallbladder attacks, or had your gallbladder removed? Do you have a family history of gallbladder disease? If you have any of these risk factors, an ultrasound to check the current state of your gallbladder before you begin is a very reasonable and responsible step. And here is something critically important. If during your time on these medications, you develop pain in your upper right abdomen, pain that radiates to your right shoulder, nausea after eating fatty food, or fever with abdominal pain, do not wait. Contact your doctor immediately. These can be signs of a gallbladder attack or acute cholecystitis, and they need prompt medical attention. A 15-minute ultrasound could save you from an emergency room visit down the road. Ask about it. Before I wrap up, I want to give you something practical you can take into your next appointment. Here are the exact questions to ask your doctor before starting any weight loss injection. 1. Can we run a full thyroid panel, including TSH, T3, and T4, and review my personal and family history of thyroid conditions? 2. Can we do a comprehensive metabolic panel to check my liver function, kidney function, and fasting glucose? 3. Can we check my lipase and amylase levels to establish a pancreatic baseline? 4. Can we test my HbA1c and fasting insulin together to get a full metabolic picture? 5. Given my personal history and risk factors, do you recommend a gallbladder ultrasound before we start? Write these down. Take them with you. A doctor who takes your health seriously will welcome these questions. And if a doctor dismisses you for asking, find a different doctor. I want to be really clear about something. I am not here to scare you away from these medications. For many women, GLP-1 medications have been genuinely life-changing. They've helped manage blood sugar, reduce cardiovascular risk, and yes, support significant and sustained weight loss. The science behind them is solid. But medicine is not a shortcut. Your body is not a shortcut. You deserve a doctor who takes the time to understand your individual health before making a prescription decision. You deserve to walk into that process with information, with tests done, with a baseline established. These 5 tests take 1 or 2 blood draws and maybe 1 imaging appointment. That's it. And they could make the difference between a safe, effective experience and one that puts you at serious risk. You are your own best advocate. Come prepared, ask the hard questions, get the test done, and then make an informed decision with your doctor, together. If this video helped you, please share it with a woman in your life who is considering these medications, because the more we talk about this, the safer we all are. I'll see you in the next one.